Good morning, good afternoon, good evening, whatever time of day you're listening to this. I want to welcome you to the introductory section of Clarkson University's HC606 Payer Analytics. I'm Leo Lichtig, your instructor for this course. I was most recently a vice president in the Data Forensics and Intelligence Group at Aon Consulting, a global health and benefits consulting firm. My contact information, email, and phone number is on the screen. And I will not have scheduled office hours, but I'm available almost any time by appointment. And the easiest thing to do is to make those appointments by email. During this session, I will give you a brief introduction to my background, go over the course goals, discuss the course format, and my expectations for you, and grading for the course. Who am I, and why am I here talking to you? My professional background includes being an econometrician with the New Jersey DRG project. That was a federally funded research and demonstrations project where we developed and implemented a new system for paying hospitals. It was a prospective payment system using diagnosis-related groups, or DRGs. Once we showed it could work in New Jersey, it was adopted by Medicare nationally and is still used by Medicare today for paying hospitals. It's also used by other payers throughout the country and in other countries throughout the world. I then moved on to be a director of utilization economics and research at Empire Blue Cross Blue Shield, then the largest not-for-profit health insurer in the country. I went over then to Network, a small consulting firm, as a senior VP and chief information officer. We were consultants to hospitals, government agencies, payers, professional associations, and our clients were throughout the United States and Canada. I then moved on to a large consulting firm called Aon Consulting as a vice president for data forensics and intelligence. Aon is a global benefits and risk insurance firm that works primarily with large employers and helping them with their health benefits, other benefits, and health risk. On the personal side, I'm a husband, father, and grandfather. And my motto, which is a haiku, although not high poetry by any means, so easy it seems once done, which yet not done, most find impossible. In other words, something may seem very hard before you do it, but after it's finished, it sometimes will seem very easy and you wonder what you were worried about. And now, who are you? Please prepare a simple introduction to yourself and post it in Moodle before the end of the first week. Include both professional information, such as what you've done, what your job is, or what you want to be doing, and something non-professional about yourself. Include why you're in the program and why you're taking this course. And anything else you think might be of interest to the rest of us who will be going through this journey this quarter. My goals for the course include introducing you to data generally available to healthcare payers. That includes what you might expect, such as claims and eligibility data, but will also include things like wellness program participation, absence data, and other information that you might have about your members that will help you and them understand what their healthcare needs are. I want to introduce you to some current analytical techniques used by payers, introduce you to some current applications of payer data analytics. And I want to point out the focus will be on the United States healthcare system, and specifically medical and prescription payers. We will not be talking about systems outside the United States, and there'll be very little talked about on dental and vision programs. And I want to point out now too that when I talk about payers, it will not just be commercial insurance companies like Aetna, Cigna, Blue Cross, United, but will include employers who pay for a lot of those insurance programs, will include government agencies such as Medicare and Medicaid, and government regulatory agencies who are responsible for payment systems and for understanding what goes on in the delivery system. We all have something to offer each other in this class. Whether you're a full-time student and haven't had your first job yet, or you've got 10 to 15 years of industry experience, we've all had exposure to the healthcare system in the United States. So I expect everyone to contribute to the online discussions and the presentations, and I expect to learn something while I'm here too. You will be making 2 presentations of the class. They will be virtual, of course, using VoiceThread. As for the course format, it will all be online. We'll be using Moodle. I'll be providing lectures every week. There will be no textbook, but there will be readings. You'll be able to select readings that interest you. We'll have group discussions every week. You'll be expected to participate in those. And you'll be making 2 presentations to the class, probably using slides with VoiceOver. That'd be using VoiceThread. Or if you can come up with another presentation method, let me know. I'm open to almost anything. There'll be one of those for the midterm and one of those for the final. Grading for this session will be based on 6 elements. There will be discussion forum topics every week that you'll be expected to participate in. That'll be 20%. Some weeks will have written assignments. That'll be 15% total. Some weeks will have reading summaries, which will account for 15%. Those are when you find a reading of your own based on the subjects we covered in the past weeks since the last reading summary. And then you provide a 1 to 2 page summary of that reading and share it with the class. That'll be 15%. There'll be a midterm presentation for 20%, a final presentation for 20%, and final exam questions tailored to each of you based on your individual final presentations. That will be 10%. So welcome to HC606 Payer Analytics. I'm looking forward to working with you over the next 10 weeks, and I hope you come away with lots of information that you'll find useful for your career and for improving the healthcare system in the United States or wherever you go.